Hi, I'm Charles Mabry, and I want to talk to you today about a paper appearing in the April 2024 JACS dealing with progressive reduction in preventable mortality in our state trauma system. We use preventable mortality review to drive provider education. In Arkansas, we had done a study in 2009 to 2013-14 at the start of our trauma system that showed a decrease in preventable mortality from 30% down to 16%, and that appeared in JACS in 2017. So in 2015, we had to ask the question about how do we continue to drive quality improvement in trauma care to decrease preventable mortality. In 2015, we began a quarterly preventable mortality review that dealt with development of the adjudication process as well as forms to record soluble events dealing with the trauma death. At the same time, the Arkansas chapter of the American College of Surgeons and the Arkansas Trauma Society began a coordinated trauma education program for the entire state. On the right, you'll see the different tracks, the Trauma Regional Advisory Councils and our different trauma centers that participated in this study. How this system worked, for each hospital, the trauma medical director and program manager would fill out the trauma death QI forms for each death, and that was then sent to the TRAC, the Trauma Regional Advisory Council, MD, and they worked together to perfect the form and get better information, and then that finalized form was sent to the Arkansas Trauma Registry. Each quarter, the registry selected a scientific sample to represent deaths in Arkansas, and that was sent to QSource, who then pulled records on that one patient, or the individual patients, from the Trauma Communication Center, other hospitals that treated the patient, as well as EMS. And those forms, those records, hospital records and EMS records, were sent to the Preventable Mortality Review Committee. And on that committee, we have multi-specialties as well as representatives from the Arkansas Department of Health. The adjudication process developed, and so some deaths were deemed to be preventable, non-preventable, potentially preventable, and feedback on the forms, the trauma death QI forms, was sent back to the trauma centers, the medical directors and TRAC, to improve their adjudication process, and at the same time, the information from the mortality review was sent to the Arkansas Trauma Society to help refine and develop new educational programs. On this slide, you can see we have several different programs for education. One was an annual trauma update. We teach ATLS every month, and then we also develop evidence-based guidelines that are on our Trauma Society website to help educate providers around the state. In addition, we developed the Arkansas Trauma Evaluation and Management course, or A-Team course, that is really aimed at level 3 and 4 trauma centers to improve their level of care. Over this time period from 15 to 22, we had over 5,000 trauma providers that received this targeted trauma education. Well, what happened? What did we find? Well, we found that of all the opportunities for improvement, we could group those into 5 major types: delay in care, circulation, airway, chest, and abdomen. And that accounted for about 94% of all the OFIs that we had in the preventable and potentially preventable cases. And those were the ones we really focused our trauma education on. Over time, in the first 3 years, we found that there's around 18% of OFIs in the P and PP group, but then that dropped to 9% in the last 3 years. Delay in care was really the most common and decreased the most over time. What about mortality? Well, we had 10% of deaths overall that were judged to be either preventable or potentially preventable. In 2015 to 17, in that 3-year time period, around 15% of the deaths were in that range, but that dropped around 7.9% of potentially or preventable deaths. So you can see a steady reduction in deaths that were preventable over that time. So our conclusions were there's not one magic bullet, but a combination of multiple factors and teams that really try to improve care and reduce preventable mortality. We really feel that the ongoing PMR process gave us valuable information over time to improve care at the trauma center level, but also develop specific types of education. OFIs decreased 50% over this time period, and our mortality decreased by 43%. Well, I'd like to thank you for looking at our video today, and also remember that there's supplemental material on the JACS website attached to our article that deals with more detail of our forms, our processes, and our other data. Thank you for watching.